What's up, guys? Hey, Jared Beckstrand here, Doctor of Physical Therapy, ToneAndTighten.com, and today I wanted to share with you some of my favorite exercises to stabilize your lower back and maybe help you out of some of that lower back pain that you might be experiencing. So let's get into those right now. All right, you guys, thank you so much for joining me today here on Tone and Tighten. I'm excited to be able to share some of these exercises with you, hopefully help some of you out of some of that low back pain that you're experiencing. If these things do help you guys, do me a favor, hit that thumbs up button down below. Okay, so a couple of months ago, I shot a video that was all about degenerative disc disease and stenosis in your lower back, how that can lead to sciatica, and I also shared a bunch of stretches. It was like 5 or 6 of my favorite stretches that you can do to alleviate some of this pain and some of those sciatic nerve symptoms. Now, a lot of you who have got relief from that have written me comments that say, well, is this it? Is this all that we continue to do? And the answer is, well, no. It's important that as soon as we stretch out and as soon as we create a little space and as soon as those sciatic nerve symptoms get under control, then the next step would be to strengthen and to stabilize your lower back in that position so that those symptoms don't come back. And so those are the things that I wanted to share with you guys today. If you're looking for that video, if you want those stretches for degenerative disc disease and for stenosis, check out the description down below. I'm also going to put a link. I'll float it in right up here right now. That's the link that will take you to the stretches that I recommend first. I would do those first to kind of create some space to decrease pain, to decrease tension in your back before jumping into these exercises. Now, here's the thing. I've got to point out what types of low back pain these are for. If you have a herniated disc or a bulged disc or things like that, I don't recommend that you do these exercises because we're actually going the wrong way with that. To treat those problems, you actually want to get more into extension exercises. What I'll do, again, check the description down below for a link. I'm also going to float that one up here. Those are your go-to exercises, again, for a bulged disc, a herniated disc, sciatica due to those types of problems. Those are the ones that you want to do. Now with this video, I've said this word a couple times already, we're going to deal with stenosis. Now, I've got my spine model to help me illustrate exactly what stenosis is and why you guys are going to benefit from these exercises. Here's your spine. Your spine is a series of vertebrae stacked in columns. The yellow part are the nerves that exit out. Basically, your spinal cord runs right down the middle of this and then sends out these nerves at each of these spinal levels right here. Stenosis refers to a narrowing of that canal or a narrowing of that hole that nerve has to exit out of. Now, some of the common conditions that cause this stenosis or this narrowing are going to be degenerative disc disease. Spondylosis is another one. Spondylosis just means degenerative changes in either the bone or the joint. Arthritis, things like that. That would be like a spondylosis. Now, younger athletes, especially gymnasts, football players, those who go through a lot of forceful extension, can actually experience a fracture or an injury to the bone. That would be called a spondylolysis. If it's a spondylolisthesis, that means that both sides of that bone are damaged with some slippage that's occurred on that vertebrae. All of these conditions are going to result in this stenosis condition where those holes that nerve exits out of are narrowed. Now you can see that if I were to bend this guy over backwards, and so it's facing this way, we're bending over backwards this way, if I were to do that, look what that does to those holes, you guys. It closes those down and it actually accentuates this problem. Now if I were to bend forward, so I'm going to take this spine and I'm going to bend it forward like this, now you can see what that does to those holes. They're super wide open, they're really big, there's actually a lot more room for that nerve to come out of. And so those are the types of exercises that we want to promote with this stenosis problem. We want to do flexion-based exercises, exercises where we're actually curling forward, working on the abs, to open up those holes in the back. I want to share with you about 6 of my favorite exercises to help stabilize your spine, to not only open those holes up, but to actually keep them open to stabilize your spine in that position. Now, one more caveat before we jump right into it. If any of these exercises hurt, cause you more pain, increase symptoms down your legs, that's a sign that we're going the wrong way and that these might not be the best exercises for you. So don't just try to muscle through it. If they hurt, if they increase pain at all, might be an indication that you might be better served with another video. So keep that in mind. Let's get into these exercises. All right, you guys, so to explain these exercises to you, I want to present them in an order of kind of easiest and least intense up through hardest and most intense. So hopefully you'll be able to tolerate something on this spectrum, hopefully be able to help you guys out. The first exercise that we're going to start with, and the first thing that we want to master, especially with these conditions, is going to be a posterior pelvic tilt. Basically what that means is I'm going to lay down on my back with my knees bent. I'm going to take my pelvis and I'm going to rock it backwards. I'm going to engage the muscles in my stomach to try to tip my pelvis backwards. I tell people if there's a big arch under your back, you'll see how my back is arched up off of the table right now. What I want you to do is rock your hips backwards and push your back down into that mat or down into the floor that you're laying on. And so that's exercise number one, is going to be a posterior pelvic tilt. Again, visualize what I showed you on that spine model. If we can get that rock down, we're going to open up some of those holes. We're going to create a little more space. That's pretty simple. As soon as you master that, we're going to add a march to it. Posterior pelvic tilt, so I want you to rock your hips backwards. I want you to tighten your tummy muscles up so you're stabilizing your spine, you're stabilizing your pelvis in that position, and then you're going to hold that while you're going to lift your leg up off the ground and then right back down. March left, march right, and then relax. Posterior pelvic tilt, suck in the stomach, tighten the abs, march left, march right, and then relax. What we're doing there is, as we're lifting the legs up towards you, your stomach has to work a little harder to stabilize and to support your pelvis and your spine in that posterior pelvic tilt position. So that's how we progress it. And so posterior pelvic tilt, and then when you can, add the march to it. Next, let's get into some crunches. And so a great way to work the ab muscles in this forward flexed position, when I teach crunches, I like to start pretty easy. And so we want to do them in the right position. You're going to get both your hands laying on your back, knees bent. Both your hands are right here on your thighs. All you have to do is engage your ab muscles, lift your shoulders up off of the floor, slide your knees to your kneecaps, and then right back down. And so that's as hard as it needs to be right there. I want to shoot for about 3 sets of 10 crunches on this. So my fingertips are on my thighs, slide my fingertips to my kneecaps, back down. I'm going to repeat that 10 times, and then I'm going to relax. When that becomes easy, I want you to actually cross your hands over your chest. Now, same thing. All you got to do is use your ab muscles to lift your shoulder blades up off of the floor that you're on. What happens here is it becomes a little more difficult because my arms are basically further away from my pivot point. Instead of over my pivot point right here in my abs, they're further away from the pivot point right up here. And so 3 sets of 10 crunches is going to be that exercise. Next, let's get into some bridges. Great way to start to work some of the lumbar stabilizers, the muscles in your lower back, but not at the sake of hyperextension, meaning I'm not ever going to extend so far that I'm closing down those holes in my spine. And so bridges, lay on your back, knees are bent. I'm going to contract my glutes, so squeeze your butt together, and then use your butt to lift your hips up towards the ceiling as high as you can, and then come back down. Now, for some of you, that as high as you can might only be to here before pain starts to settle in. I'm okay with that. The goal is going to be to go up as high as you can, kind of to that pain point, and then as you continue to do these for weeks, you'll get higher and higher through more and more of a pain-free range of motion. Contract the glutes, lift your hips up as high as you can. You can even hold it up there for a 2 or 3 second count, and then come right back down. The highest you need to go is a neutral spine position, so knees, hips, shoulders should be in a straight line. That's as high as you need to go with your bridges. Okay, next let's roll over and we'll do what we'd call some bird dogs. So for this, you're down here on all fours. Again, this is going to be a great spine stability exercise, but we're not ever going to get into that hyperextension position. And so we're in this nice neutral spine spot. What I want you to do is extend your left leg straight back behind you while raising your right arm straight up in front of you right here, and then return to the starting position. Now we're going to go left arm, right leg, and then back. What I don't want you to do is, you see how I'm really trying to accentuate, see how my back is really extended right now? If you do have this stenosis condition going on, that's not going to be the most comfortable position for you to be in. And so what you need to do is one of those posterior pelvic tilts. You see how I flattened out that curve in my back? Hold that position. So now my abs are engaged. while we're going to do this bird dog with these alternating arms and legs. So I'm working my spine stabilizers, but I'm also engaging my abs. I'm strengthening my spine in the correct position. Okay, and so that's your next exercise, is going to be your bird dogs. The last two are the most intense, but in my opinion, the most effective if we do them correctly. So let's get into some planks and some side planks. For the plank, what I'd recommend is, if you need to start with a modified plank, do it on your knees. So you're going to lay down on your stomach, elbows underneath your shoulders, and then you're going to engage your abs to lift your pelvis up off of the floor, but you'll see that my knees are still down. So that would be a modified plank. That's where I want you to start if you've never done these before. Again, should be pain-free, but we also want to work those abdominal muscles out. To show you what the full plank looks like, now I'm going to go up on my toes and elbows, and that's what the full plank looks like. You're just going to hold it static. I tell people to shoot for 20 seconds 3 times. When that becomes easy, go to 30 seconds, 40 seconds, 50 seconds, even up to a minute 3 times is what I'd recommend. Now, with these planks, a lot of times people will say, well, that hurts my lower back. And it's the same thing. You see how what I just did with my lower back? See how it's nice and rounded right now? All those little holes are closed down. It's going to pinch on those nerves. That's really going to tick your back off. What I want you to do is that posterior pelvic tilt again. So engage those abs to flatten out your back. And now my pelvis is kind of tucked up underneath myself. My back is nice and flat. That's where I want your plank to be. I don't want it to be here. This is hanging out on ligaments and vertebrae. You can do that a long time and it really hurts your back. Here, when we flatten the back out, tuck the hips up underneath us, all of a sudden now we're really engaging those core muscles to make this a lot more effective, to make it a much better exercise at working your ab muscles. So 3 times, kind of 20 to 30 second holds is what we're going to do on the planks. Last exercise is going to be some side planks. Really good at working the lateral muscles, the obliques, and especially that deepest abdominal layer, that transverse abdominis, all crucial in stabilizing your spine. And so how we'll do this, we can start with modified. I'm on my right elbow and I'm on my right knee, my right leg's bent, my left leg's out straight. We're going to pop up, raising my side up off of the bed. On my right elbow, on the outside of my right knee, I'm engaging these right oblique muscles to keep my hips raised up high. When that becomes easy, 3 times 20 to 40 to 50, 60 seconds, what we're going to do is actually come up into a full plank. I'm going to try to do this on my massage table. And so now my right leg's extended. I'm up on my right shoulder, my right elbow's right underneath my right shoulder in this nice straight line. You'll see that my nose, belly button, between my knees, between my ankles is all in this nice straight line. I'm really trying to engage these lateral muscles to hold that position. And we're going to shoot for about a 20 second hold. You can do that 3 times. When that becomes easy, you'll do a 30-second hold 3 times, 40-second hold 3 times, and so on. And that's how you progress those. Okay, you guys, there you have them. 6 of my favorite exercises you can do right at home to treat this degenerative disc disease, this spondylosis, spondylolysis, spondylolisthesis, basically this stenosis problem. Stenosis is, again, that narrowing of the holes in your back, pinches on your nerves, causes you pain. These are the exercises that I want you to do to hopefully stabilize your spine and help you guys out of some of that pain that you might be experiencing. So I hope you guys found that beneficial. If you did, do me a favor, hit that thumbs up button down below. Also, if you haven't done so already, I hope you take this chance to subscribe to Tone and Tighten here on YouTube. I'd love to see you back here for future videos. If you do have any questions, comments, or even suggestions for future videos, please leave those in a comment down below. I'll get to those just as soon as I can. And until next time, you guys, that's it for me. Thank you so much for watching. I'll see you again here on Tone and Tighten.